The COVID worldwide outbreak has led to a dramatic challenge for all healthcare systems. Cancer patients are significantly impacted by the COVID pandemic. They are more likely to become infected than the general population and significantly more likely to die from COVID-19 once infected. But the greater risk may be altering or foregoing cancer treatment. So the main issue when treating a cancer patient is to develop a tailored treatment plan that optimizes cancer care and reduce the risks from COVID. Interventional radiology has a critical role in the management of patients within the healthcare system, being involved in both the treatment of emergencies as well as chronic disease, and has a pivotal role within the therapeutic pathway of many oncologic patients as well, also during a pandemic situation. So due to the close patient contact and invasive procedure performed, our activity is characterized by a greater risk of acquiring and transmitting infection. So that IR services would be prepared to perform elective or emergency procedures also under these extreme situations. This makes it imperative and mandatory to develop and set guidelines in order to limit transmission while optimizing resources, rearranging work sites and health force, enforcing segregation and disinfection parameters. Yes, it is mandatory to follow procedural approaches for IR workflow. First of all, we need to create different dedicated routes and facilities to reduce contamination, performing when possible bedside US guided procedure to avoid moving and transporting suspected or positive patients out of their room or area. We also need to reduce the access to the ANGIO suite, but also to the hospital, restricting for visitors, specialists, or external colleagues, using video consultation or virtual platform for multidisciplinary tumor board discussions. As the duration of this pandemic is hard to predict, and it is taking longer than planned, in this phase, we are trying not to postpone outpatient and elective activity, but we are trying to perform an accurate triage of patients and an accurate use of appropriate protection equipment for patients as well as for health workers while performing procedures. It is a similar scenario. In addition, we have only to remind that when performing pulmonary procedures such as biopsy, ablation, pleural drainage, we can have complications such as hemoptysis with consequent coughing and resolution. So that needs to be considered high-risk procedures needing airborne protections. We need to provide the best service in a safe way. Protection of patients and physicians is mandatory, in particular when dealing with oncologic patients which are fragile and at high risk for infections.